Good morning once again, anywhere where you watch us from. Welcome to Health Matta. Benio Ilera Logun, that is health. Now be the secret of enjoying person wealth, because the wealth where you get, where health no they included, no complete. So on that premise, I say good morning once again. Welcome to Health Matter. My name is never change. I still Chief Olododo. A few minutes ago, I did tell you say with Doctor Ogbonge Doctor, you go day in the building with us. Yes, GP, general practitioner. I'm talking about no other person but Dr. Bartholomew Ofegbolam. Now be the CEO for Grace Valley Medical Center. Good morning, sir.
Good morning, sir. Chief.
Good to have you here again, sir.
So pleased to be with you this morning.
Yes, sir.
Yeah. Good morning, viewers at home and around the world. We'll be looking at a topic we started last week. December 1st was World AIDS Day. Usually every year, the world marks World AIDS Day on December 1st. Okay? Now, World AIDS Day essentially is a time of a global assessment of where we started in the fight against HIV, where we are at the moment, and where we want to be. And last week we did mention that a lot of significant achievements have been made over the years in the global fight against HIV. Okay? This morning we'll be looking at what HIV/AIDS is all about. We'll talk about the symptoms. We'll go over the symptoms like we did last week. Talk about the risk factors. Talk about the types. Talk about the diagnosis. Talk about the HIV testing services. Talk about prevention, because that is the most essential aspect that we all need to know about. And then if time permits us, we'll go as far as treatment. Okay? So HIV/AIDS, as we all know, has to do with a chronic illness that affects the immunity of an individual. HIV, human immunodeficiency
Syndrome.
That's it. HIV, human immunodeficiency virus. AIDS, acquired immune deficiency syndrome. Acquired immune deficiency syndrome. Okay, so those are two coinage. Okay, HIV is at the beginning of the spectrum. AIDS is at the end of it. Okay, now what causes AIDS is HIV. Last week we dwelled richly on history surrounding facts surrounding the history of HIV in the world.
But this morning you talk about the story of one robot, if I remember the name.
Yes. Well, this morning we'll be looking at some other things that we need to know about HIV/AIDS. Okay, so HIV continues to be a global pandemic. Okay, it continues to be a global issue of concern to WHO and to the global community. HIV/AIDS, the major outbreak actually started in the 1980s. And of course, at that time, not too many information were available about the disease. But over time, a lot of significant achievements have been made to the extent that it is now a manageable chronic illness. Maybe just like hypertension, diabetes, and other chronic illnesses. Okay? Now, why is this so? Let's just look at some of the facts from WHO. At the moment, at the end of 2018, about 37.9 million people are affected by this scourge on global proportion. That's roughly about 38 million people. Now, out of this figure that were affected or that are living with HIV/AIDS, 79% of these people already know their status. So what about you? Do you have an idea of your status? Today is still a good time for you to go and do so. So that means that about 21 million people are living with HIV without knowing their status. And the key to staying alive, the key to prevent having to infect the people around you is knowing your status. Okay? Now, out of this number of people that have HIV or that are living with HIV, 63% of them are currently receiving treatment for HIV. And about 52% of this set of people have been able to suppress the virus that causes HIV to the extent that they cannot infect people around them. That's a massive achievement. Okay, so when we talk about prevention and treatment these days, we look at the use of ARV, antiretroviral drugs, for prevention as well as treatment. Don't forget, as we already know, HIV does not have any cure at the moment. Okay, there is also no vaccine that can prevent HIV at the moment, but researches are ongoing along this line. Okay, permit me to also narrow it down to our African sub-region, WHO sub-region. Out of this figure of nearly 37.9 million people that have HIV globally, about 2/3 of them, or more than 2/3 of them, are said to be from Africa.
Wow.
That's about 25.7 million people that are living with HIV actually are within WHO African sub-region. That is massive. 2/3 of the entire people living with HIV.
That's massive.
Okay? Now, permit me to also point out that children who have been affected by this scourge, only about 54% of children and adolescents are currently receiving treatment for HIV. Also, according to WHO, between the year 2000 and 2018, there have been about 37% reduction in HIV new cases globally. Okay, and there have also been about the global community have been able to achieve about 45% reduction in death, in HIV-related deaths on a global scale. Okay, so thereby saving about 13.6 million lives within this space of 18 years, year 2000 to 2018. And how was this possible? Because of the newer studies, because of the newer treatment guideline that is available today that people are benefiting from. Okay, so what causes HIV? That would be a good question. HIV is a viral infection or a disease that's caused by a virus. Usually, some viral infection can be self-limiting, but not all of them are self-limiting. Self-limiting means with or without treatment, they can go on their own. Okay? Now, in terms of HIV, we have HIV-1 and HIV-2 that just HIV subtypes, if you like. Now, how can one pick this HIV infection? And what are the manifestations? What are the signs and symptoms that one can have? And then you need to start thinking about going to have yourself checked up by your doctor. Okay? Signs and symptoms of HIV. Permit me to start by saying that sometimes HIV, when one is infected with HIV, the person may not have any significant symptoms. The person may not have any symptoms at all. So in some situations, it can be asymptomatic. But usually within the first few months of being infected with HIV, such a person or such an individual can have some flu-like symptoms, which could include symptoms like fever, sore throat, rash on some parts of the body, as well as some other minimal symptoms that may not actually be a huge cause for concern. Keep in mind that in this environment, we have a number of disease conditions that can actually present in this way. So it's actually difficult for one to know.
Which we term as flu. Say I have flu.
Yes. Or even malaria or typhoid. Okay, so the initial set of symptoms can actually occur within the first 2 months of an individual of having picked this infection. Suffice also to say that after this set of symptoms may have elapsed within weeks, also, there's also what we refer to as window period. When someone picks HIV, what happens is that the body system tries to fight back. In trying to fight back, the body system produces antibodies against HIV. So most of the testing kits we have at the moment, what they do is to pick out to identify the presence of these antibodies that the body is producing in a bid to ward off or to combat this infection, this stranger that has invaded the system. That is what is picked out. Usually, from the time of picking up the disease or picking up the infection to the time of producing these antibodies, it could last for about 28 days in most people. Now, within these 28 days, such an individual can actually test for HIV, and of course, it can become negative. So that is the concept of the so-called window period. Suffice also to say that within this window period, such an individual can actually infect people around him or her that the person is sexually exposed to without protection.
Since the virus is already there.
Yes, within the system. Okay? It's only after that period that the testing kit will be able to pick up these antibodies that the body is trying to generate in trying to fight this scourge. Last week, we pointed out that there are 3 stages of HIV: the acute HIV stage, which is the primary HIV, and then the latent HIV, or the chronic HIV stage, if you like, and then before it gets to AIDS. So at the beginning, I said it's just like from one end of the spectrum, you have HIV infection, and then the third end of it, if such an individual does not receive any form of treatment, it can actually progress to the level of AIDS. What happens in the human body when one picks infection is that there is a gradual destruction of the immunity of such an individual. Our immunity, when it is healthy, when it is normal, we're able to ward off, it helps us to fight off infections. We're able to ward off infections that try to infiltrate into our bodies. But when such immunity is destroyed over time, such a person loses this ability to fight infection. A person becomes immunodeficient or immunocompromised. Suffice also to point out that it is not only HIV that can cause or can lower someone's immunity. A number of other disease conditions can actually do so. Okay? Some form of cancers, leukemia, diabetes in some cases can actually lower one's immunity, but maybe not as much as HIV. Now, when such an individual has his or her immunity lowered, the person will now become exposed to opportunistic infections. These are infections that ordinarily wouldn't have affected such an individual. But because the immune system has been destroyed, the person is now prone to all sorts of infection. Top on the list is candidiasis, oral thrush, which sometimes we see in a number of people that are immunocompromised. Okay? Now, I also want us to talk about the signs and symptoms of HIV. Signs and symptoms of HIV, I said at the beginning, may not show any symptom. It may be asymptomatic. The flu-like symptoms are usually found in the early stage of HIV. By the time it's getting to the second stage, you can now start seeing some more pronounced manifestation. Such an individual may have to contend with unintended weight loss. The person will be losing weight. The person can also have prolonged fever, okay, night sweats. The person can also have other secondary bacterial infections that can come into the picture. Top on the list is tuberculosis. We said it last week that tuberculosis has a special association with HIV. Some authorities put it that 1/3 of HIV-related deaths are often traceable to tuberculosis. Not just tuberculosis, people who have HIV too who also have pneumonia. Okay, so these are the symptoms that one can have in the second stage of HIV when such person does not receive any form of treatment until it graduates to the AIDS-defining stage or the AIDS stage, in which case such an individual must have attained some appreciable level of destruction of the person's immunity. Okay, in such situations, you also witness weight loss, prolonged diarrhea, fever could also be there. Some AIDS-defining symptoms can actually kick in, like Kaposi sarcoma, some forms of cancers, lymphoma, and what have you. So these are some of the signs and symptoms that you can see when one has HIV moving on to the stage of AIDS. Now, how is this infection transmitted? That was where we stopped last week. The transmission of HIV can be through a number of routes. Number one is through body fluids, okay? Body fluids will include blood, will include semen, sperm, include vaginal secretions. These are avenues through which one can pick up HIV infection. Also, HIV can be transmitted from mother to child. Okay, so that's what we refer to as mother-to-child transmission, otherwise known as vertical transmission. Okay, it can be transmitted from mother to child during pregnancy, during delivery, and of course, during breastfeeding as well. Okay, apart from mother-to-child transmission, also unsafe use of unsterilized medical equipment can actually be an avenue to transmit this disease. That some people who have what we refer to as needle stick injuries in the hospital, people who get accidental needle pricks in the course of working in a hospital environment. It happens to doctors, nurses, and people who work in the laboratory. Okay, so it can happen to anybody. It is also common among drug users, people who use injectable drugs, people who abuse drugs that share those sharp objects or needles that they usually use for such drugs, or even share the solutions. Is also common among people, men who have sex with men, homosexuals. Okay. Now, as a matter of fact, WHO described key populations. There's a certain group of people that WHO calls key populations when it comes to HIV. Now, key populations will include...
Okay, sir. Let us hold you a bit there, sir, so that when we come back, we'll actually enjoy the meaning of key population, because we are learning so fast. Thank you very much, sir. Let's go on this shikini break. Health Matta, we'll be right back. Please go nowhere.
Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top with health matter. You fit also advertise your product and services on top with show where dey help people. Terms and conditions apply sha o.
Stands for Acquired Immune Deficiency Syndrome, which means deficient immune system. You get AIDS after becoming infected with the HIV virus. You get infected with the virus by unsafe sex, contact with blood of an infected person, for example by using a contaminated injection needle, from mother to child during pregnancy, childbirth or breastfeeding. Because the virus is transmitted through blood, sperm, vaginal fluids, preseminal fluid, breast milk. You don't have the risk of becoming infected with the virus by saliva or shaking hands. When you have HIV virus but aren't symptomatic yet, you are seropositive. That means that there are HIV antibodies in your blood. You don't need to have any signs of disease yet. An HIV infection passes through 4 stages. In the first stage, the body can show signs of disease like continuous fever and swollen glands, while some people who are infected remain asymptomatic in their first stage. In the second stage, recurring airway infections, skin, mouth, and genital lesions often occur. In the third stage, you may have complaints like prolonged diarrhea, excessive weight loss, tuberculosis in the lungs, and other serious infections like meningitis. Finally, besides serious infections, the nervous system may be affected in the 4th stage, which can result in motor loss or AIDS-related dementia. It may take 5 to 15 years before you know that you've got AIDS. This is because sometimes it takes longer for symptoms to occur. HIV and AIDS can be treated with medication but can't be cured. Antiretrovirals slow down the multiplication of the virus but doesn't kill it. To support the treatment, AIDS patients often get medications to boost the immune system and fight against infections. You can prevent AIDS by having safe sex and using clean needles.
Yes, you're welcome back to the show. And before we go on that break, we will also see that video. The doctor, they explain some things on
Key populations.
e-population. So what in e-population you mean?
Okay, now key populations according to key populations according to WHO are simply put groups of people who have an increased vulnerability, who have an increased risk of picking up HIV infection more than the other people in the same population. Okay, now this group of people include men who have intercourse with men. They include people who are in prison settings, prisoners in closed settings. They include commercial sex workers and their clients, okay, as well as people who abuse drug. What we mean drug addicts, we're looking at injectable preparations. Okay, so these are the key populations that are usually much more exposed. As a matter of fact, the new cases of HIV in the year 2018, more than 50% of new cases of HIV in the year 2018 were found in this group of people, in this group of people that are called key population. So these are risk behaviors that can actually predispose one to picking up this infection. Okay, so we are going to look at risk factors for HIV.
Okay, sir, before we go to the risk factors, it's important we let our people, our viewers know that the phone lines are open. Please feel free, call in, ask anything. When they do your mind yaga yaga as far as HIV tabi AIDS they concern. Our doctor dey gidigba to make sure say and give good answers to any questions we wanna ask. Maybe I should quickly start with my sir. Malaria and typhoid was once paraded as diseases where they uncurable. They say that time, say once person get them, nah, death sentence. And we also read it in textbooks like that too. But these days, malaria and typhoid parasites now waiting with a token amount person go cure. Now HIV AIDS pandemic has also been paraded as such, say no cure so far. But you as a medical doctor, sir, want you to give us what are the updated research or researches that are going on. Abi so far so good, the thing still remains say no cure and no research, because I know that a day will come when most definitely this disease will be something will stroll to Grace Valley and it will be cured.
Thank you very much.
You're welcome, sir.
Yeah, I'll read that question to mean that you want me to talk about advances that have been made in the fight against HIV.
Yes, sir.
They're enormous. I will start by saying that since the HIV as a disease was discovered, about 32 million people have died from this scourge. So that number is humongous. That number is massive. 32 million people have lost their lives as a result of HIV since it was discovered. That said, also, between the year 2000 and 2018, a whole lot have happened in terms of improvement in treatment and care for people who have this infection, to the extent that there were about 37% reduction in new cases, 45% reduction in HIV-related deaths that resulted in preventing about 13.6 million deaths over a space of 18 years. Now, that has been possible because of the increased knowledge about the disease, increased knowledge about the treatment guidelines, and as well as prevention or prevention that a lot of people have been able to put into. We have Ayuba from Nasarawa. Ayuba, good morning.
Good morning, sir.
How are you there, Ayuba?
Fine, sir.
You need to be audible, please. Speak up.
Yeah, okay, I'm fine, sir.
Okay, your question.
In regard to the transmission of the HIV and AIDS, you made mention of unsterilized equipment.
Okay.
Does it mean that the HIV and AIDS can survive outside the victim's fluid for 1 hour or immediately, or it has the duration of expiration that it can live outside the
Thank you very much for that question. Very important question. Now, his question, we made mention of use of unsterilized needles. Okay, so he wants to know what duration can it be possible for one to still be infected when one uses such an unsterilized needle. Okay, the number of authorities have said that HIV cannot survive outside the human body for more than 30 minutes to an hour. Okay, that is also true. Okay, but what we are talking about is in a situation where people who inject themselves with drug, one person finishes at a time and you're transferring such injection to another person, to your friend in the house, and the person is using it almost at the same time or within minutes apart. Or sometimes occupational hazards in hospital setup can also happen, and you inject someone. I can tell you that it's not everybody that steps into hospital that gets tested for HIV.
Sure.
So you can inject someone with needle and then mistakenly it pricks you. It has happened plenty of times. So you're going to see what you can do or what you need to do in such cases. Also, people who get violated, who get raped, they face the same type of challenges.
So if it happens, sir, you are trying to tell us if it happens immediately and we are aware, there is a way we can prevent HIV.
Yes, there's a way. 30 minutes. Yes, there's a way we can prevent HIV. When you get exposed to accidental needle pricks, okay, in a hospital setting, or you get exposed sexually to somebody that you're not sure of his or her status, but at that time, but maybe afterwards you get to know that you've actually been exposed to someone with HIV. We have Lawal from Niger. We'll come back to the question.
Well, Lawal, good morning.
Good morning, sir.
How are you doing?
Fine, sir.
Okay, go ahead with your question, please.
Sir?
Go ahead with your question, Lawal.
Good morning.
And turn down the volume on your TV sets, please.
Hello, sir.
We can hear you.
Reduce the volume, please.
Can you hear me now?
Yes, better.
Please, I
Lawal? I think we lost that, sir.
Okay, so if you discover hopefully you'll be able to call back. We want to hear your question. If you discover that you've been exposed accidentally, that's what you can do. Now, it is referred to as PrEP, post-exposure prophylaxis. That's also, I'm mixing it up. That's what you can do when you get accidentally pricked and you discover such a person has HIV. Okay? There's PrEP and there's post-exposure prophylaxis. PrEP is pre-exposure prophylaxis. I will talk about that. But what we are looking at now is post-exposure prophylaxis. You've been exposed. Post is afterwards. Okay? So let's get it right. So post-exposure prophylaxis is a situation where such an individual will have to be placed on HIV drugs. We call them ARVs. Okay, antiretroviral drugs or treatment for a period of 28 days, and it must start within you must initiate such a treatment within 72 hours of such accidental needle prick or such accidental or casual exposure. Okay, so when you're able to do that, you will prevent yourself from picking HIV. It is also on that note that people who have HIV or somebody who has a partner that has HIV can be on these drugs in order not to pick up the infection. We'll still talk a lot about this, post-exposure and pre-exposure prophylaxis. Okay. So if you get exposed accidentally, be it sexually or otherwise, there is a way out so that you don't get the infection. Okay, wow. So that's called post-exposure prophylaxis. Also, the ARVs that we have now, they do two things. Don't forget that at the initial stage we said that HIV cannot be cured.
Sure.
The ARVs, they can suppress the replication of the virus. What that means is to stop the fast multiplication that this virus usually is associated with. Okay? Now, apart from doing that, it suppresses this virus in such a way that it reduces to a level that it becomes undetectable in the blood of such an individual.
Wow.
So undetectable is equal to untransmittable. There's a slogan like that. Undetectable equals to untransmittable. So that has been one of the major ways that globally, that's been one of the major ways
That's a
that
giant
HIV have been minimized. The transmission of HIV have been reduced on a global scale. Because when people who have HIV, as many of them that are on treatment, currently about 79% of people who have HIV know their status, 63% of them are on treatment. This set of people that are on treatment, out of this set of people that are on treatment, 52% have been able to achieve this suppression that we are talking about. That means that those people will be incapable of infecting new people. And that is a massive, massive landmark.
I believe so.
Okay, so that can happen. It is also on that note that two partners or a couple now, heterosexual relationship, we are talking about a man and a woman now. So it's on that note that a man, okay, we have Mohammed from Benue. Mohammed, good morning.
How are you doing, Mohammed? Good morning, Mohammed. Are you there, Mohammed? Oh, we lost that. Heterosexual partners now.
Yes, heterosexual means between
Man and a woman.
yes, opposite sex. Okay, between man and a woman. It is on that note too that a woman who is HIV positive can live with a husband who is HIV negative, and they both can have children that will be HIV negative. That can happen now. Those are some of the landmark achievements that have been made in the fight against HIV.
Would the population be without contraceptives, sir?
Of course, if there are barrier contraceptives, there won't be exchange of gametes. The reproduction will not take place.
Okay, I was just thinking.
What we are saying is that people who are on this drug effectively, not after a while you stop, people who are on effective ARV can actually have intercourse with people who do not have it, someone who does not have HIV, and not infect the person.
Wow.
So in that way, it is possible to procreate among such couple or such individuals.
That's a good development.
So the ARV are not just to suppress the drug, they make it impossible for people who have it to transmit infection to others. And our target that by 2030, the world would have gotten to a level that will be able to eliminate this scourge. I can tell you that we have Onome from Delta. Onome, good morning.
How are you doing, Onome?
Fine. Good morning, sir.
Yeah,
good morning, sir. Your question for the doctor, please.
The question is, they said they talk about. Good morning, sir.
Good morning.
Good morning. Tune down the volume on your TV set, please.
So that we can hear you well.
Good morning. My question is, you said something about if you get infected by mistake. Yes, when you get infected by mistake, what is the way out? What can you do?
It's not if you get infected by mistake. Let me think of the word a little. If you get exposed, okay, because if one has a sexual encounter with an HIV positive person, the person will not be positive.
So you're not infected yet.
Okay.
You may have been infected, but it won't be picked out. Okay, we talked about the concept of window period. Okay, so when you get exposed and you discover that such an individual is HIV positive, let me paint a case scenario in a hospital setup. Usually for us, health caregivers or healthcare professionals, if you get an accidental prick injury, needle stick injury from any patient, you must cancel the patient, ensure that you talk to the patient and then take the patient's blood and screen to find out the status of such a person. And that if you do and you discover that such a person is HIV positive, you have to make sure that that treatment is initiated. Or let me even say something that we all know or familiar with. If someone gets raped, you may not even catch the person. The rapist to screen the person
of course.
to know whether he or she. But usually,
to stay safe.
Yes, usually people who get raped, they go through this treatment modality. They go through this treatment regimen. That is the standard of care.
72 hours.
Within 72 hours. What will happen is that for the victim or a person who gets raped is an unfortunate thing. We're not encouraging that in our society. For anybody who gets raped, make sure you get to the hospital, even if you don't want to tell anybody, especially by someone you do not know his or her status. When you get to the hospital, the first thing that needs to be done is to check your own status, to test you. If at the point of testing you, you're positive, you didn't actually get it from the person who may have performed that act. What it means is that you must have been HIV positive before that time. But if you're negative, you must be put on post-exposure prophylaxis, this set of drugs that you need to be on for 28 days. By the same token, if it is accidental needle prick, if it is casual exposure, you still need to go through this treatment guideline or treatment modality to ensure that you don't pick HIV. Now that we are talking about post-exposure prophylaxis, let me also talk about pre-exposure prophylaxis. Okay. Now, this pre-exposure prophylaxis is in a situation where one already knows that maybe his or her partner has HIV. That in order not to get it, you can be put on this drug. You can start taking some set of HIV drugs that will help to prevent you from picking it from your partner. But that is not routinely done, okay? Because people who are living with HIV, this ARV treatment is a lifelong affair. You don't stop taking it. There's no holiday in between. There's no break. You just keep taking it for the rest of your life. And Good 18 will have newer treatment regimens that are friendly with reduced number of side effects and all that.
Okay, so just asking, the ARV, that's the antiretroviral drug now, sir.
Therapy.
Or therapy, is it commercialized or is limited to only doctors? Is it what you can stroll to the counter and say, my pharmacist, please give me ARV, or there's nothing of such, sir?
It is a different setting. It's a different ball game in a number of countries. But in Nigeria, we have centers where one can get those drugs. Okay. Usually, when somebody is diagnosed with HIV, we are getting to diagnosis now. When somebody is diagnosed with HIV, one singular test is not enough to say such a person is HIV positive. Okay. So when you're diagnosed with HIV, what needs to be done is that the doctor refers you to a center, okay? Usually an established government center. In Lagos, say we refer people to National Institute of Medical Research, NIMA, Yaba. We can also refer to the teaching hospitals and other tertiary hospitals around. If you go there, you have a confirmatory test done for you. Okay. So that initial testing that you probably had done in a hospital is not enough to say you're HIV positive. It's only when you have gotten a confirmatory test that is positive that you can say, that one can say, yes, this person is positive, and of course, such a person, WHO advises.
Sorry, sir, we have Friday. Good morning, Friday.
Good morning, sir.
Yeah, you need to be audible, please. We can faintly hear you. Friday, you need to make yourself audible. Okay, hello?
Yeah, good morning, Friday. We can barely hear you, sir.
You need to call us back Friday, please. You need to just call us back. Over to you, sir.
So
we're risk factor.
Yes. So risk factors: having unprotected anal or vaginal intercourse. That's top on the list. Okay. Having another sexually transmitted infection. HIV on its own is a sexually transmitted infection. Don't forget. Now, when you have another sexually transmitted or some other sexually transmitted infection, it increases your chance of having this infection.
You mean like gonorrhea?
Like herpes, gonorrhea that my e-doctor mentioned.
Wow.
Chlamydia, and syphilis. Wow. Especially those ones that come with ulcers. They predispose one to having HIV. It increases one's chances of picking up the disease. Receiving unsafe injections, unscreened blood, which of course is no longer
practicable now.
Is no longer obtainable, at least in Lagos environment, because of the strict screening mechanism that the government have been able to put in place. Also, through organ transplantation, okay, when you do a transplant without properly screening the individuals involved, that can happen. Of course, occupational hazard, we have mentioned that, experiencing needle stick injuries, this can happen in a hospital environment. So diagnosis, how is the diagnosis of HIV made?
So we men that goes to the barber's parlor with without their own clipper now, where they are making that, can such be?
Yes, anything that can inflict, that can breach the skin, that can breach the integrity of the skin, can actually expose one to AIDS.
Well, we have to stop you there. So on that note, men, go and get your clippers, please. Don't let us toy with such things.
Don't get involved in risk behaviors that can expose you.
Thank you very much.
See you next week.
See you next week. Bye.